O yan. Ano po kagad to? Diyos ko. Lymph node. Nakita niyo yung capsule. May subcapsular space. Yan yung cortex. Sa baba niya, medala. O organ. Spleen. So ano dapat na malaman nyo? Ayun.
Patayin sa ilaw.
Yan, no? Yan. Ito white pulp. Ito red pulp. Alam niyo na kung bakit? Yung red pulp kasi there are red blood cells. O yan. O yan, no? Central artery. Yan yung red pulp, white pulp, yun yung red pulp with splenic cords of Bilruth with the splenic sinuses. Sa theoretical, the splenic sinuses are lined by endothelial cells and special elongated endothelial cells called, tapos na kayo mag-exam nun. The splenic sinuses is lined by endothelial cells and special elongated endothelial cells that are responsible for determining if a red blood cell is abnormal. Ang tawag doon?
Pulse?
Wala. Pulse periarteriolar lymphoid sheath yun eh. Yung nakapaligid dito, periarteriolar lymphoid sheath. Buong yan, white pulp. Yung sa red sinuses, mayroon staph cells. Oo. Kaya importante yung staph cells kasi pag sickle cell, pag megaloblastic anemia, pag infested with malaria, pagka malaki, pagka young yung red blood cell, sinisequester niya. That's why your spleen does not filter lymph, but it is the graveyard of your red blood cell. Bakit ba nagiging graveyard? Because of the staph cell. And what are the staph cells? These are theoretical na nga yun eh. Oh, what is the organ?
Trachea.
Kapag nakakita kayo ng tracheal gland, trachea. So this is one is lined by pseudosplanchnic epithelium, but we want to show the lamina propria, which is sa araw, lamina propria, which is what? Loose lymphatic tissue. O ano yan? Asals corpuscle. Organ, thymus. Sa theoretical, ang pwedeng tanong yan, these are made up of epithelial reticular cells which are endodermal in origin. Why did I emphasize endodermal origin? Because all the reticular cells of the lymphatic organ comes from the mesoderm, except the thymus, where the epithelial reticular cells are endodermal in origin, specifically your third and fourth pharyngeal axis. Di ba nag-exam na kayo dito ng theoretical, di ba? Hindi pa. Sige, kung hindi pa, hindi pa. O yan. Asals ha, asals. So this is the medalla, yan. You find the asals in the medalla, and the very would be the cortex. Remember, there are no nodules. Kasi, ang nodules are made up of the lymphocyte. While, this one has no teeth. Oh. This is an example, may mas malinaw. Yun, mas malinaw. So this is a lymphatic nodule. These are made up of B cells. Now this lymphatic nodule has active lymphopoiesis that they are. That is why the cells there are young, cytoplasm are abundant, so they are like staining, ang tawag dyan, germinal center. Because there are lymphatic nodules, for example, the lymphatic nodule that you find in the Bayer spots. No? Usually, wala yung mga lymphoblasts. Why? Because they are not actively developing. They are just for immune system, but they are not developing yung mga nakikita natin. Unlike here, in the tonsil, there are young lymphoblasts. What are they doing? They are having multiplication, yung tawag na cloning. Okay? Halimbawa, meron kang B cell na panlaban kay bacteria A, nag-multiply kasi specific siya ng maraming B cell para labanan yung bacteria A through immunoglobulin. They are specific. A good example is your vaccination. If you are vaccinated or if you are exposed to a disease, you will develop your anti-bacteria that specific. The more you are exposed, the better will be your protection. Pero meron exception. Yun naman siya ma. Kasi yung dengue virus, the more that you are exposed,
Nice.
Hello. Ginagawa. Paano, organ? Nag-iba yung structure at pointer.
Yoko sa red pal. Ano yan?
Central
Time.
artery ba? Central artery sa spleen to.
Spleen.
Organ. Organ, kailangan masagot mo yan. Kundi, hindi na ako maniniwala sa'yo. Tonsil. Kanina
Ano?
mo, di mo nala.
Tonsil.
Organ. Subcapsular sinus, therefore the organ is lymph node. Hindi subscapular, ha? Subcapsular, may sumasagot na subscapular. Mali yun, ha? Subcapsular sinus. Organ. Kita nyo, itong prayer spots ito, meron din siyang
Duodenum.
center. At saka, tama, idiom, kasi nakakakita kayo na intestinal
tama.
glands na may panel cell. Okay, organ.
Spleen.
Organ. Organ.
Thymus.
Kanina, bilib na bilib. Nawala. Basta importante, review na. Parang time kayo, identify nyo lang yung organ muna, ha? Organ. Kasi pag alam nyo ng organ, madali na yung susunod na question. Organ. Organ. Organ.
Thymus.
Di tayo mo. Organ.
May trabeculate.
Last, ito na yung pinaka-review niya.
51 slides.
Kunyari, ano yan? Tapos,
Basta, hindi ko mati. Shut up, I can see. Wala, nilagay.
Okay, organ ha?
Gallbladder. Gallbladder. Gallbladder.
Bahala na si Batala doon sa susunod. Organ lang. Pag pinakita ko, organ lang, ha?
Yes, Doc.
Huwag yung hintayin yung katabi niyo. Sumagot na kayo at the top of your voice, wala namang man.
Gallbladder.
Hindi na kayo magkakamali. Parang ano to eh, parang pagka-resident ka, pagka-intern ka, parang pag-clerk ka, may license to fill ka pa na hindi ka mabagay. Kasi pagka-lisensyado ka na, bawat pagkakamali mo, pwede ka galinin.
1 week per 10 MB.
Clerk ka, kapatay ka. Bawat 2 months. 2 months ka, babalik ka. Kaya yung residente mo, tatanggalin ng lisensya. Hindi ka, wala ka ng lisensya. Pag nakamatay kayo, ang sasabihin, for the sake of science. Okay na, ganito na. Ito na, kasi ganito na yung parang exam nyo. Okay. Ready?
Game.
Bilisan nyo kasi pag naunahan kayo, makichuchuwa na lang kayo. Wala na. Sayang. Pagkakataon nyo. Ganito lalabas.
Pagos na? Lymph node.
Galing.
Shit.
Appendix, galing.
Wow.
Ilyo, galing.
Ewan.
Okay. Tayo mo sa sagot.
Thymus.
Walang organ na hasas.
Split. Time.
Ano pinili mo? Hala, bibigay ko yung tonsil pag nagkamali ka. Alam mo?
Ano yan?
Wala na ha? Bibigay ko yung tonsil. Hanapin ko yung pangalan ko.
Ano yan?
Tumaba ka ha?
RR. Ano yan?
Tonsil lang.
Spleen. Spleen. Trabeculate. Liver. Pati liver. 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 Esophagus. Radium, ilium, stomach, colon.
Ito
Ano yun, Doc? Tayo niya ko. Appendix.
tandaan niyo yan, Dudino. Ang isang huwag yung tatatag, yung kakalimutan. Sabi ba, next lining of the esophagus, parietal cell as the characteristic cell of the stomach, panad cell as the characteristic of the small intestine, Peyer's panel as characteristic structure of the ileum, okay? And then the Brunner's gland as a characteristic structure of your... Now, if they ask you for the layer, although this one is already in the mucosa, the original layer is your submucosa. But they may create the mucosa. Ang sagot dapat ay para ding esophageal glands. Ang esophageal glands ay meron sa lamina propria, meron sa submucosa, pero karamihan nasa submucosa. Oh, ay. Okay.
Left.
Vermilion border, huwag nyo kakalimutan yan ha.
Just stop.
Vermilion border. Ang wala, hindi ko na ilagay dito yung taste bud. Taste bud. And that's the labial gland, ha? Vermilion border again. Tignan niyo yung may butas-butas, SSNK, yung merong corneum, keratinized epithelium. Okay, yung pancreas, highlight of Langerhans, ha? Okay. So, that's it.